12 foot signs of diabetes you shouldn't ignore. Did you know that your feet can provide insights into your overall health, especially regarding diabetes? Imagine if your feet could talk. What would they reveal about your well-being? Whether through subtle sensations or clear physical signs, your feet can provide vital clues about the existence and management of diabetes. Now, let's see how learning to read the signs your feet give can help you take steps to improve your health. Sign number 1, feeling numb or tingling. Numbness or tingling in extremities, often a symptom of neuropathy, can result from prolonged high blood sugar levels damaging peripheral nerves. These nerves are crucial for transmitting signals between the brain, spinal cord, and the body. High blood sugar harms the blood vessels that nourish these nerves, impairing their ability to function and causing sensations like pins and needles. This symptom typically begins in the fingers and toes and can progress to more severe pain or complete loss of sensation. The reduced ability to feel pain or notice injuries, such as cuts on the feet, heightens the risk of infections and ulcers. This lack of sensation is a significant concern, as untreated injuries can lead to severe complications. Therefore, managing blood sugar levels effectively is critical to preventing further nerve damage and reducing the risks associated with neuropathy. Sign number 2, slow healing. Diabetes complicates the complex cellular and molecular processes in wound healing, especially in the lower limbs, where blood flow and nerve function are often impaired. High blood sugar levels, typical in diabetes, can damage blood vessels, impeding circulation and limiting the supply of oxygen and nutrients needed for fixing tissues. Additionally, diabetes-related neuropathy or nerve damage can lessen sensation in the feet, causing individuals to overlook injuries like sores, minor cuts, blisters, or abrasions. These injuries may then progress untreated, developing into more severe ulcers or infections. Diabetes also disrupts the inflammatory response. A critical initial wound healing phase further delays recovery. The weakened immune function seen in diabetes compounds this problem, increasing vulnerability to infections that can hinder healing and result in chronic complications. Sign number 3, calluses and corns. Calluses and corns are areas of skin on the feet that thicken due to ongoing pressure and friction, often where the foot rubs against shoes or the ground. In individuals with diabetes, these can develop more frequently and become thicker due to altered weight-bearing from nerve damage, which affects muscle function and changes how weight is distributed on the feet. This abnormal pressure causes the skin to protect itself by thickening in specific areas. Additionally, poor circulation, a common issue in diabetes, impairs skin health and its capacity to heal, causing calluses and corns to become more obvious. The nerve damage or neuropathy associated with diabetes also reduces foot sensation, making it less likely for individuals to notice the discomfort from these skin changes, allowing them to worsen unnoticed. Sign number 4, changes in texture. Changes in the texture of the feet are common indicators of diabetes and its effects on skin health. High blood sugar levels can cause skin changes, including dryness and cracking, often due to dehydration from increased fluid loss and reduced sweat gland activity. This dryness makes the skin more susceptible to breakdown and infection, especially in areas that bear weight, like the heels. Additionally, diabetes-related neuropathy can impair sweat gland function, leading to decreased sweating and further exacerbating skin dryness. Poor circulation associated with diabetes can also cause the skin to appear shiny and smooth, a sign of tissue ischemia. Sign number 5, edema or swelling. Edema in diabetes refers to swelling due to fluid accumulation commonly seen in the legs, ankles, and feet. This condition can be attributed to several diabetes-related issues, such as blood vessel damage and poor circulation, leading to fluid retention in tissues. Additionally, kidney dysfunction, often a complication of diabetes, diminishes the kidney's ability to eliminate excess fluid, thereby contributing to edema. Certain diabetes medications, including insulin and thiazolidinediones, might also promote fluid retention as a side effect. Furthermore, heart disease, which frequently accompanies diabetes, can worsen edema, especially in cases of heart failure. Peripheral neuropathy, another complication of diabetes, could impact nerve functions that regulate blood vessel activity and fluid balance. Managing diabetic edema involves tackling its root causes, which include enhancing blood sugar control, treating kidney disease, adjusting medication regimens, and adopting lifestyle modifications. Regular monitoring for edema signs and seeking timely medical consultation are essential for preventing complications and maintaining good health in individuals with diabetes. Number 6, poor circulation. Cold feet can be a subtle but significant sign of diabetes, often associated with poor circulation. High blood sugar levels from diabetes can harm both blood vessels and nerves, reducing blood flow, particularly to the feet. This decreased circulation can make your feet feel cold. Additionally, diabetic neuropathy may affect how temperature is perceived, leading to a sensation of coldness even if the feet are not cold. Recognizing this symptom is vital as it indicates the condition of both the circulatory and nervous systems. Effective diabetes management, including controlling blood sugar, exercising regularly, and caring for the feet, can help improve circulation and reduce these sensations. Understanding the implications of cold feet is crucial for comprehensive diabetes management, emphasizing the need for proactive steps to preserve foot health and overall well-being. Number 7, change in skin color. Color changes in the skin of the feet, such as red, blue, or pale hues, are significant indicators of underlying diabetic complications, often linked to poor circulation. In diabetes, elevated blood sugar levels can damage blood vessels, impair circulation, and reduce the supply of oxygen and nutrients to the skin. This can lead to visible changes in skin color, where a bluish tint might suggest poor oxygenation, and redness could indicate inflammation or infection. These changes are more than cosmetic. They provide important insights into the vascular health of individuals with diabetes. Prompt recognition and management of these signs are crucial, involving reasonable blood sugar control and consulting a healthcare provider for ongoing changes. Regular foot examinations and thorough diabetes management are essential to prevent severe complications and enhance overall health. Number 8, peripheral artery disease, PAD. Pain during walking, commonly overlooked, is a significant sign of diabetes-related complications. This type of discomfort, known as claudication, typically stems from poor circulation, a common problem in diabetes due to the damaging effects of high blood sugar on blood vessels. This vascular damage limits blood flow, especially to the legs and feet, causing pain and cramps during activities like walking. This pain is more than just a simple ache. It indicates that the muscles are not getting enough oxygen-rich blood. Moreover, diabetic neuropathy may also contribute to this pain by impairing nerve function in the legs and feet, intensifying the discomfort experienced during physical exertion. Number 9, loss of hair. Hair loss on the toes and lower legs can indicate diabetes-related complications, typically associated with poor blood circulation. Elevated blood sugar levels in diabetes can harm blood vessels, restricting blood flow to the feet and lower legs. Hair follicles depend on a sufficient supply of blood for nourishment and growth. When circulation is impaired, these follicles don't receive the nutrients they need, resulting in hair loss in these regions. This symptom goes beyond a cosmetic concern. It signals deeper vascular issues related to diabetes. Number 10, foot deformities. Foot deformities are frequent complications stemming from untreated diabetic foot issues, significantly impacting mobility and foot health. For instance, hammer toes, characterized by bent or curled toes due to muscle and tendon imbalances, are often worsened by nerve damage from diabetes. Similarly, bunions can form as the big toe shifts toward the second toe, creating a painful bony protrusion at the joint. Diabetes-induced neuropathy can exacerbate these deformities by reducing sensation and altering walking patterns, which increases pressure and friction on specific foot areas. Moreover, Charcot's foot represents a severe complication where bones weaken and collapse due to the loss of sensation and repeated trauma, both consequences of neuropathy. This can lead to significant deformity and instability, complicating walking and heightening the risk of ulcers and infections. Preventing these deformities in diabetic individuals requires proactive steps like regular foot examinations, wearing appropriate footwear, practicing good foot hygiene, and controlling blood sugar levels. Catching and addressing issues early is crucial to prevent deformities from worsening and stopping other problems, underscoring the critical role of comprehensive foot care in diabetes management. Number 11. Infections. Infections are a big risk for people with diabetes due to the disease's adverse effects on the immune system. Diabetes weakens the body's ability to combat pathogens, making people more vulnerable to infections, particularly in areas susceptible to injury, like the feet. Foot infections are particularly concerning when there are open wounds or ulcers, common complications in diabetes, as these provide an entry point for bacteria, heightening the risk of infection. Untreated foot infections can quickly escalate, leading to severe issues such as cellulitis, a bacterial skin infection that can spread to deeper tissues, and osteomyelitis, a bone infection. Cellulitis can cause redness, warmth, swelling, and tenderness, potentially leading to systemic symptoms like fever and chills. Conversely, osteomyelitis typically causes localized pain, swelling, and sometimes drainage from the affected bone, often with fever and general malaise. The consequences of untreated foot infections in diabetes can be grave, possibly resulting in prolonged hospital stays, the need for antibiotic therapy, surgical intervention, or even amputation in severe cases. Preventative measures like proper foot hygiene, regular foot checks, immediate wound treatment, and optimal blood sugar levels are crucial for minimizing the risk of infections and their severe complications in people with diabetes. Sign number 12. Foot ulcers. Foot ulcers are a serious problem caused by diabetes, significantly endangering the health and well-being of those affected. The combination of persistent pressure or injury to the feet, alongside impaired circulation and sensation, common in diabetes, sets the stage for ulcer development. High blood sugar can slow down how wounds heal, making individuals with diabetes especially prone to developing foot ulcers. These ulcers often occur in areas that endure repeated trauma or pressure, such as the football or heel. Neuropathy, a frequent complication of diabetes, heightens this risk by reducing sensation in the feet, which makes minor injuries or abnormalities less noticeable to the affected individual. Foot ulcers are open wounds that can vary in size and depth and carry a substantial risk of infection if not properly managed. Diabetes can result in various foot-related issues, including neuropathy, ulcers, and other complications. Awareness of these risks is vital for those managing diabetes, as it enables you to prioritize foot health and overall well-being actively. Maintaining stable blood sugar levels, conducting regular foot checks, and obtaining prompt medical care are essential. Each step is critical in avoiding complications and maintaining a good quality of life.